Hey guys, it's Dr. May. What's going on? I'm here to talk about disorganized attachment, which is the fourth part in my four-part attachment series. And we'll get into some details about that today. All right, it's kind of a complex topic, but I'll give you just a general overview. All right, so disorganized or fearful attachment. Sometimes in adulthood it's called fearful attachment, but I'll probably mostly refer to as disorganized. Okay. All right, so quick review. What is attachment in general? So attachment is about the bond that a mother and a baby forms, or a caregiver and a baby. And it starts there where there's an interaction between the two. And depending on the child's perception of the parent's sensitivity to their signals and their needs and how they take care of them, depends on the way that the child develops, right? So children are very dependent on their parents for survival. And so we make as a child adaptations to form ourselves to the parent that we have, right? And to kind of adjust ourselves so that we get the best care from that particular caregiver. All right, but it's kind of a pattern that we develop that we then take into later life, and then we transmit it to other relationships. Okay, it's kind of like procedural memory. It's kind of a unconscious memory that we kind of act out with other people. Okay, and it becomes our pattern. However, it is possible to change it. And disorganized attachment is, a very problematic attachment style in a lot of ways. It creates a lot of distress later in life or also earlier in life. And it's probably something you'd want to work on if you have that. But the good news is that it is possible to work on that. And I'm going to give some tips at the end as well. Okay. All right. So this is the attachment style that's on the bottom left, which is noted to be Charlie Brown. I'm not sure if Charlie Brown exactly has disorganized attachment, but for the sake of argument, this diagram, we'll just run with it. Okay. So he's in the quadrant where there's high anxiety of abandonment, but there's low proximity seeking. So it sounds kind of like counterintuitive, like how do those two really go together, right? But there's kind of a lot of contradictions in disorganized attachment, which is what kind of makes it disorganized, right? So we'll talk about why this is the case, all right? So first, let's talk about the parents, okay? So on the one hand, sometimes disorganized parents come across as frightened of their child, right? So it's hard to take care of a little person, right? You might be a little freaked out about their needs, and they're crying, and they need diapers changed and food, and I don't know what to do. And the parents might be very dysregulated. They might be coming to parenthood also with their own trauma, right? And they might be wrapped up in their own frightening sensations and feelings and memories, and they're bringing that into the relationship with their child, right? So they might have a lot of fear that comes from their own past, right? So they might have fight or flight or freeze responses to the child based on their own stuff, right? They might have an exaggerated startle response, which could be a little frightening to the child even, They might back away instead of come close to a baby when the baby really needs them. They might speak in a frightening voice instead of a calm prosodic voice. Their expression might be a little dazed, and that could be very disruptive because babies need very, responsive kind of facial expressions and eye contact. But if the parents are very wrapped up in their own trauma, they may not be able to be as facially responsive, or they may not be able to have that kind of very soft kind of gaze. You might have more of a frightened kind of eye, they call it hypotonic eyes, like kind of like a little open and fixed, okay? Which is kind of, disruptive to the baby. It's uncomfortable for the baby. They may not be as responsive to the baby's signals and needs, which is kind of not giving the baby adequate mirroring. And they may be withdrawn and avoidant of the baby. So maybe the baby keeps crying and they don't really pay attention to them, or they don't really recognize which signal is which. When are they hungry? When do they need attention? When do they need to be held? When do they want to run away, right? They may not fully be in touch with that, okay? Because they're so wrapped up in their own trauma perhaps, and bring a lot of anxiety to the relationship. And as you know, anxiety is kind of contagious. Like if someone's in the room with me and they're anxious, I start to feel their anxiety, right? So if the parent's anxious, the baby starts soaking up their anxiety. So instead of regulating the baby, you're actually dysregulating the baby, okay, for all these different reasons. And if there's disruptions because of their behavior, their frightened behavior, they don't know how to repair it. They don't know how to fix things with the baby, make the baby feel better, right? They just kind of like create this chaos that they're bringing into the situation. And then it never really repairs itself. Okay, so that's one of the problems too. Okay, on the other hand, this picture really disturbs me, doesn't it? Oh, that guy makes so angry, right? But disorganized parents can also be very frightening. Okay, these are like the abusive parents. They get into their own fight response. They might be overreactive to the child, yelling, having very attacking kind of postures. They might talk with a low booming voice, which it makes us feel like it's a predator. There could be a lot of invalidation, like mocking or teasing, or verbal abuse, physical abuse, sexual abuse, intruding on the baby's self-concept by intruding their emotions and their own stuff on the baby. Very emotionally reactive. So you're not going to be regulating the child. You're going to be dysregulating the child with your emotional displays. Might make loud, startling noises, grunts and groans and yells and stuff like that. And just like threatening and abusive, scaring the child, okay? And again, even here, also no repair. So they're really frightening the child, they're really threatening, they're hurting the child, and they're not making up for it in any way. Okay, so here's the pattern. I didn't do the best job with this graphic, so forgive me, but try to follow along. So let's say on the top, the parent is frightening, okay? So the mother is yelling at the little boy, the boy's clearly frightened, okay? And when you have a frightening parent, you have two competing survival instincts. One is to fight, flight, or run away, right? Or defend yourself, sorry. But the kid's small and the parent's really big. So the kid's not gonna be able to successfully fight the parent, most likely. They may not be able to run away because they're just a little person. And the doors could be locked or there's nowhere really to go. And they may not really be able to adequately defend themselves. The parent could be hitting them, and what are they going to do? Go like this? They're little. The parent's going to come around and hurt them anyway, right? So they're trying to do those things, but it's not successful. On the other hand, children also have the instinct to attach as a way to protect themselves from danger, right? So if something's scary, you might run to your mom and give her a hug, right? But in this case, the same person who's frightening me is also the same person I might have an instinct to run to for protection. So it puts me in this weird kind of bind rather. Like the person I'm supposed to protect myself from is also the person I'm running to for protection. And I kind of get caught in this push-pull or this like go forward and reverse. And it makes my system freeze. I get into a freeze response, okay? And so the freeze response is an immobile response. The other responses that are listed there are mobilization responses. You're doing something, right? But when you're not able to do something, your body goes into freeze, right? So just like if you were an animal in the woods, like a deer, okay? So deers, like in that picture, they may not be able to escape certain predators, okay? They can't really run away. They can't really fight back. So they freeze, like the deer in the headlights, okay? So that's what you end up doing. So if you're struggling now with things like dissociation and brain fog and zoning out and losing time and stuff like that, it's probably because when you were little, the freeze response was the response that made the most sense. That was probably the only thing you can do. So you have to validate yourself that this is what my body tried to do to protect me. It was the best thing it was able to figure out. Now I need to do something different because it's interfering with my life, but back then that was why this happened. Okay, so let's talk about the relationship of the disorganized children and parents. Okay, so one dynamic that starts to happen is there's a bit of a role reversal. Okay, so as the kids get a little older, this keeps the kid connected to the parent, but also inhibits their dependency needs, right? Because it's hard to feel like you're depending on somebody that's hurting you, right? But at the same time, you still need somebody. So it kind of becomes a compromise. So this could happen in a couple different ways. One is that I might caretake the parent, right? So I might appease an angry father, or I might comfort a really anxious and weepy mother, right? Because it puts me in some kind of connection with them, maybe makes it a little bit safer too. But it's really not appropriate because the parent's supposed to be caretaking me. But by compromise as well, at least have some relationship if I caretake them. Okay. Another version is for me to get punitive or bossy, right? Maybe the parent it was punitive and bossy to me, and I figured out that that's something I need to do to them. Maybe my father's really angry and my mother's kind of dependent and mousy, and so I get punitive and bossy with my mother. So I start bossing her around, and that keeps me feeling more in control because I feel like I'm in a very out of control situation where parents aren't setting appropriate limits. They're not really protecting me. So it makes me feel like, well, I'll just take the role of the parent that was never really there, and I'm going to be the one to boss you around. Okay. Sometimes as adults, we see people acting like policemen, like they butt into other people's problems and they try to step in and tell people what to do or try to, get control of the situation. That's kind of a version of that happens later on. All right. Okay. Disorganized children and people who grow up having been disorganized children. All right. One of the key problems is you don't have an internalized feeling of safety. Okay. You literally were not safe growing up because you didn't get the physical and emotional protection you needed. Your needs may not have been met adequately. So you never internalized a sense of safety. Okay. So even if you're not actually in a dangerous situation now, you might always have this feeling that something is wrong or that something's threatening or that the other shoe's about to drop. Okay, so that's like a procedural memory left over from the time when you truly were not safe in your household. Okay, so you need to do work now on establishing a sense of safety. We'll talk about that a little bit more later. Also, as you can imagine, with the disorganized parents, you never learned how to emotionally regulate. They were constantly dysregulating you and not giving you any coping skills for regulating yourself. So right now, you might really be struggling with that. Okay, you might have very high emotional arousal sometimes, get really emotional mind, or you might dissociate and cut off your emotions and not really feel much of them at all. So you have a hard time self-regulating and also allowing other people to help you regulate in a co-regulating type of a way. Okay, so let's say you have a therapist now and it's hard for you to even allow your therapist to help you or to take in whatever help they're giving you. All right. Difficulty with trust, kind of for obvious reasons, right? If you had untrustworthy parents who didn't have your best needs at heart in their interactions with you, it's very hard to trust that other people will. Okay. So you might be ultra suspicious of people and you might alternate between totally pushing people away without trusting them at all, even if they're worth possibly trusting, or jumping to overly trusting people way too quickly. You might bounce back and forth between the extremes. Okay, also because you were in a lot of danger for a variety of reasons, you tend to be hyper vigilant. So you're always on the lookout for threat now. Okay, so you scan your social environment, you look to other people, you try to figure out where the threat is so maybe you could handle it, or you won't be caught as surprised about it. So you might be seen as somebody who's a little suspicious or paranoid, not in a psychotic way necessarily, but kind of just like, a little bit suspicious of people because you don't believe that they're really going to have your best intentions. And also much more dissociation because of the, that freeze response we were talking about, and splitting because it's hard to have an integrated self if somebody wasn't really validating you and caring for you properly, and multiple models of self. So we'll talk about that in a sec. Okay. Another thing that happens when you have a disorganized presentation now, okay, the multiple models of self, there's a lot of shifts in state. So sometimes, let's say, you might feel more like a child mode, and all of a sudden you're getting a little mousier and a quieter like a child, and you sound like a little like that. Or other times you might get an angry mode, and you might be like, roar, much more strong. Or other times you might be kind of a bossy mode, or, or things like that. Like you might switch back and forth between different aspects of your personality. Not necessarily dissociative identity disorder, but you might notice more like I'm very different across different situations. I don't feel like I have that much consistency within me. Different emotions pop out at different times. Sometimes I'm very present and sometimes I'm very dissociated, right? So these are like shifts in state, right? Okay. Pauses and silences. So when you speak, if you're especially in more of a dissociative mode or someone brings up a topic that's triggering, all of a sudden you might have this very blank look on your face. Like some people, you could tell that something went wrong, something switched, and they're a little bit more like that, right? Kind of like the guy in the right in that picture, like, although it has nothing to do with the bottle necessarily, but like that blank eyes, the hypotonic eyes, difficulty with eye contact because you're afraid if you look in someone's eyes, you're just going to see threat there, shame, different things like that. And if you had no other way that you figured out for managing your emotions and all these distressing things you've been going through, you might be somebody who relies on target behaviors because you couldn't figure out a different way, okay? Not that I'm condoning that, but it helps explain it, okay? Cognitive styles. As you could tell, it's very hard to think clearly when all this stuff is going on, when you're very emotionally dysregulated, okay? So when things are coming up, when you bring up your past or something triggers you, your thoughts might get a little bit more scrambled. It might be harder to focus, might be harder to have like very linear, clear thinking that other people can follow. So there might be a little bit more of an incoherent way of communicating. There might be pauses and silences in the middle of this incoherence too. You might feel a little confused at times. Sometimes it's hard to remember things. Sometimes you might lose presence and zone out or dissociate in the middle of it and get more disoriented. Sometimes it's like they talk about lapses in reasoning, like the tenses you use might change. Like sometimes if I listen to somebody, they're talking about something and it sounds like it just happened, but then it sounds like it was 2 years ago. Then it sounds like it just happened. Or it sounds like they're talking about somebody and they're talking about somebody in the present tense, like the person's still here. But then it sounds like, oh wait, the person died. But you're talking about him as if he's still alive. You're in a present tense. Like it kind of gets a little confused. The tenses could get back and forth. So that's the dead, not dead kind of thing. Again, depersonalization, dissociation. Definitely gaps in memory, right? So if things were really traumatic, you may not have encoded them in your memory very clearly. So it may be hard to remember stuff from the past. And sometimes things will trigger it and the memories will come back to you. But sometimes it's pretty common not to be able to remember stuff, okay? Okay, so here's the multiple models of self thing I was talking about. And I have a whole video on this called Parts of Self. And I talk about these different aspects of self in detail. But basically, if you've been traumatized in this way, and you have this disorganized attachment, part of the fragmentation is switching very strongly between these different parts of yourself and maybe like hating different parts and not really accepting different parts, or you're not having much communication between the parts, right? So, or certain parts are not allowed. So that's part of the problem, that ultimately you need to work on integrating these parts, accepting them, loving them, listening to them, trying to fulfill their needs the way they weren't fulfilled in the past. So all this is going to be really important in your recovery. And again, check out my Parts of Self video. It's a little too long to go into detail now, but it goes over all about how to do this and what this is about. So these are basically your survival responses that kind of become different self states, and they come out at different times to help protect you, okay? All right, and as you could probably tell, disorganized attachment is very closely related to what they call complex PTSD or developmental trauma. Okay, right now, unfortunately, they're not official diagnoses in the DSM-5 for kind of political reasons, but a lot of people know that it exists. A lot of researchers and psychologists and psychiatrists acknowledge it. So you could definitely read up more on those two topics as well, and it'll give you some insight into your disorganized attachment. Another thing to say about disorganized attachment is you might have a different, more predominant style. Like let's say you're anxious avoidant, or you're mostly anxious ambivalent, but in certain circumstances, with certain people, you might get a little disorganized, okay? It doesn't necessarily mean that if you have disorganized attachment, it's like that all the time with everybody, right? There could be like pockets of healthier interactions, but sometimes something kind of like wigs you out and you get a little bit more offline, okay? Okay, so treatment strategies. We're moving toward more secure attachment, okay, which is still possible, all right? 1, mindfulness, okay, which is basically good for everything. When you're really triggered and you're really in trauma mode because of your disorganization, your prefrontal cortex, which is the clear thinking, wise mind part of your brain, is not online, okay? So to bring it back online, mindfulness helps a lot, okay? And that gets you thinking more clearly. Being curious about your emotions, your body sensations, your thinking also gets your prefrontal cortex online, okay? So that's really important. So I would practice mindfulness however you need to do it. And if you need to start with your eyes open, grounding yourself in physical sensations because it's too freaky to close your eyes and just breathe or something, then do that. Okay, there's all different ways to be mindful. You could even just increase your awareness during everyday activities. Okay, so just be a little bit more awake and present as you do more and more things. Okay, and eventually the idea is to become a little bit more present as you're feeling your emotions or as you're talking about painful things. So instead of dissociating and losing it or getting too emotionally, triggered and, activated, you can try to stay in a medium kind of level, which is like a window of tolerance. Okay, so mindfulness is a great way to keep practicing doing this. All right. When you identify the different parts that you have, like from that other diagram, and you figure out when they're coming out and what they're all about, how they're trying to protect you, you could have more compassion toward them and say, thank you for trying to help me. Maybe you need to step back a little bit, dial it back a little bit, but I appreciate what you're trying to do to help me survive, and that was what your main purpose was for me, right? Also, creating a sense of safety. If you grew up in an environment where you were really feeling unsafe a lot of the time, you had that internalized sense of not being safe. And so now you need strategies to feel safe. Okay. I invite you to check out my video about that very topic. Okay. I have a whole thing about creating feelings of safety, and I go over a lot of techniques for what to do. Okay. Just a little bit more than I could give right now. And finally, emotional regulation or affect regulation strategies. Okay, DBT is great for this. The stress tolerance skills, mindfulness skills, emotion regulation skills, all really helpful. Okay, so that also helps keep you present, keeps you in that window of tolerance. And if you never had somebody help you regulate them before, this is the perfect way to start. Okay, all right, so that's it for that. There really is a whole lot to say about this topic. I know this is kind of a brief overview, but I hope it helped clarify things at least a little for you. All right, and gives you some direction about where to go next. Okay, if it's really intense, I hope you go to therapy or try something like that, or DBT especially. I know it's really hard. Okay, I'm not trying to make it sound like just do these things and it's over. Okay, it takes a long time to get yourself screwed up and a long time to get yourself better. But I hope this maybe is at least a little bit of a start for you. Okay. So thanks for listening, and I'll see you soon. Bye, guys.